Hello and welcome to Hope Channel Kenya. My name is Kandio Dhiambo and you're watching Positive Living. And here we take care of your mind, your body and your soul. You're living with HIV and AIDS. We tell you how to live a long life. Not just a long life. Long life. Healthy and productive life. And joining me on set as always is Brenda Kinyangi from Adventist Center for Care and Support. Brenda, welcome.
Thank you so much.
Thank you for joining us. So the last time we talked about testing. You tested, made that decision, went to your nearest healthcare provider and tested. Good move, but you're positive. What's next? So Brenda, I'm positive and I'm feeling fine. Is there a need to start treatment?
It's very important immediately you get to know that you're HIV positive to start treatment immediately. Basically,
but I'm feeling fine. I'm very okay.
And that is the best time to start treatment. When you're fine, when you're strong, when you're healthy, when you don't have anything that is bothering you, that is health-wise, that is the best time to start treatment for the drugs to continue to maintain your immune system the way it is, and even more than how it is.
Okay. So I've been positive for a while and I decided to start treatment. Is that period between my testing positive and that time period in which I start taking my drugs, does it sort of interfere with the drugs effectiveness?
I'll start from the beginning the way I've said. I've said immediately you turn HIV positive, you are advised to start ARV treatment immediately. Taking some time still thinking about I need to start later is not going to help anyone. It's only going to damage more of your immune system. So we encourage all our patients who have already tested to be HIV positive, like you're using yourself as an example. If you test you today, you turn positive, it's very important to start the treatment immediately.
Is that what we call the antiretroviral therapy?
Very true.
And what exactly does it involve apart from the drugs?
Actually, antiretroviral therapy is just part of the HIV regime drugs, whereby actually when you take the drug, the first step I usually advise is acceptance. Because if you don't accept that I have been tested, I am HIV positive, even if we tell you the importance of these drugs, you won't see the need of it. If you tell you that you need to avoid stress, you won't see the need of it. So everything starts with acceptance. You accept, then you have exercise. You don't just sit, because you've turned HIV positive, you decide today I'm going to sit, because my life, it's like it has come to an end. It has not come to an end, but what we just encourage is living positively. We say acceptance, we have exercise, we have taking a lot of water and clean water, and we talk about even fruits, eating fruits, eating a balanced diet. We talk about even prevention, it also comes along with it.
And all these things we'll talk about in depth in the very coming series. So when you start this antiretroviral therapy, how many, you're taking drugs and when you go to the doctor, you're diagnosed with whatever condition you're given, there's this set of drugs, there's this set of drugs. So how many pills does this involve?
It depends with yourself, with the immune system. Basically, we usually say when you turn HIV positive and you're put on antiretroviral therapy, they are being supposed to be taken for life. You don't take today and tomorrow you decide apana, I'm calling it a quits. No, you have to take it for the rest of your life, because that is how it will become more effective. That we talk about a good adherence. Are you adhering well to drugs? That's what you get when somebody turns to be HIV positive. When they come back to the clinic, they undergo a situation whereby somebody is there just to work with this person. looking at how have you been taking drugs. Are you been taking them on time?
Okay.
Or have you been forgetting?
So you have to, for instance, set a timer or a reminder on your phone. I'm taking my drugs at 8 o'clock.
Very true. If it will help you, do it. If it help you, do it. If you have somebody who's close to you, like a confidant, who can be able just to be reminding you, like even a loved one, then kudos for you, just do it. But if you don't have, and you know you yourself, you are a poor person when it comes to adhering to drugs, then do the alarm, set your phone, anytime, anywhere, you just know this is the time I'm supposed to be taking drugs.
And what if I forget by bad luck? I had my alarm, but still I snoozed it and I forgot to take my medication. What happens next?
When you actually forget taking the drugs, what do you do to yourself? You just lower your immune system, even the effectivity of the drug. So it just encourage you yourself or any other viewer who's just watching and has been taking drugs or has been starting, just to try and not to forget to take the drugs. Because when you forget, it means also you give some time for the virus itself in your immune system to be able now to know that you're taking the drugs. Because HIV virus is very intelligent. When you look at it on a scientific level, it is very, very intelligent. When somebody adheres so well to the ARV treatment, it reaches a point, it becomes like dormant.
Okay.
So you become normal. Nothing, you're just there, you're living your life. God has given you the breath. So when you stop immediately, you give this HIV virus that the drug has been stopped. Now it changes because it's a sly virus, I can say. It's a sly in its own way. So I'll just encourage any viewer who's watching just to adhere to drugs. If you forget, kindly go back. Don't double take it.
Yes, I wanted to ask, what if I decide to compensate? I forgot to take them at 8 today, but tomorrow I'll take twice.
I wouldn't want to encourage that, but I'll just like to refer the viewer who's watching right now just to go back to the clinician or the care provider who was with them, just to tell them, by the way, mimi nilisahau kumeza dawa. Then they'll be able to guide them on what to do next.
So let's say I'm this loyal person to my antiretroviral therapy, and like you said, I'm adhering to the medication, and everything is working well. The drugs are working. I'm very fine. I'm healthy. My viral load is almost undetectable, and I decide, let me go on a medication break. Do you advise that?
Actually, I won't advise that. And it's so sad when I just hear from you, and also I look at the experiences that I've been able to get to from some of the patients or clients who have actually defaulted from drugs, maybe because of the myths and the misconceptions that are going on, that somebody has gone, maybe has been prayed for, and they've been told they are healed. I usually say, why come back again and try to get another test if you say you have been healed? Why come back and test God with
confirm
with man-made material? But I would like to tell, it's good actually to balance your value and the reality. And the reality is, when you have been tested, you are HIV positive. If you are positive, you are positive. If you're on treatment, please stick to your treatment. Take your treatment, walk your spiritual life, and God will be there for you.
So still, I am taking my treatment, and it's a condition, a lifelong condition. I'll be taking these drugs forever. And
for the rest of your life.
Yes.
That sounds
and
better.
we when we're sick sometimes, and you're given some drugs and you have to take them for a couple of days or some weeks, you get tired. So it was something we call pill fatigue. So I am a person living with HIV and AIDS. I've been taking my drugs, but I feel like today I'm just not feeling, I don't feel like taking these drugs. What do you tell such a person?
I'd just like to encourage them, because I can just try to put myself in their shoe. It's really overwhelming, but I'd just like to encourage them, wasichoke, because it's for their own good. You're not doing it for your doctor. You're not doing it for the healthcare provider who's there, but you're doing it for yourself and for your own life, for your immune system. So I'll encourage them just to keep on. Akiwa amechoka, sometimes it's just good for them to join some support groups. We usually have some support groups, people who have been there, taking drugs for nearly 20 years and above, or 15 years. They sit down with them in the support group. They hear their stories and they hear their success stories, because it's very important, and they'll just feel encouraged to move on. But in case that one keeps on happening, they should also just go back again to the clinician and just confide to them, this is how I'm getting when anytime that I'm taking drugs.
So the clinician probably will perhaps give a different regimen to the patient,
depending if the regimen is not working. But if it's working well, how it's supposed to work by boosting the immune system, then the person just needs adherence counseling.
Oh, so it's mostly it's usually the mind,
psychological,
by the way. Yeah. So what about side effects of these drugs?
Side effects are normal.
Yeah.
I don't want to say that they are so harsh. Any drug is
has a side effect.
Yes, but it's just normal side effects. We have sometimes a bit of headache. We have the fatigue itself comes along with it. We have dizziness, but after some time you get back to yourself. But I usually say, if you want to succumb all this, that's why I usually encourage when you're taking not even the ARV drugs, but any drug you're supposed to take with a lot of water.
Okay.
I usually encourage most of my clients, whenever they are taking ARV drugs, depending on how it reacts with them. I usually say in the morning, first of all, start with water.
In the
take
morning?
Take
before
some
you take anything?
Yes. Take some warm water first.
Warm water?
Yeah, relax a bit. Then if you can, do heavy breakfast and take light. You eat like a beg at night, and in the morning you eat like a king. So in the morning, if they can be able
when
to
you
do
say
gali,
eat like a beg at night, what do you mean exactly?
You just eat light.
Light, very light.
Very light, and you take your drug and you sleep comfortably. Like you get, like most instances, what usually happens, you get somebody usually takes the CTX, that is the Septrin, or the antibiotic, they usually take within the day. But the ARV drug itself, they usually take it when they are going to bed. So it depends on how they have been put their regime. But I'll just encourage any person who's taking the drugs and it has very high side effects on them, just to do simple therapy. Take water, warm water, pumzika kidogo, ukieza. If you don't have food, take porridge. Some facilities do provide porridge for the infected. So take the porridge.
Are those facilities that provide this porridge, is it special, not the usual mix we'll go to the supermarket and find?
It's a special one, just to help them with all this, sometimes, lack of appetite and all that. So they do the porridge, then they wait a bit, then they take the drug, then they wanapumzika kidogo, then they are good to go.
Wow, what wonderful tips. Coping tips for the side effects, because sometimes they can discourage you, and that's where the pill fatigue comes, and you're like, I cannot do this anymore. But dear viewer, worry not, because there's this and so much more from knowing how, if your treatment is working, if it's not working, what do? We touch on that and so much more when we get back from this short break. Remember to follow us on our social media pages, interact with us, share your views, whatever you think. We'll be ready to just know what you're thinking. On Facebook, Hope Channel Kenya. On Twitter, at Hope_Kenya. SMS us through the line running down your screen. When we get back, like I said, there's so much more for you, so do not go anywhere. Hi, welcome back to Positive Living. If you just joining us, we're talking about treatment and antiretroviral therapy, what it means to be positive, and how to treat being positive to live a long, healthy and productive life, and be a member of the society that is not bringing us down, but instead lifting us up. Because HIV and AIDS, like I always say, it's incurable, yes, but it is treatable. Brenda, we were talking about side effects, and you've given us some very, very good coping tips. But how do I know now that my treatment is working?
Actually, how somebody knows their treatment is working. Everyone who's HIV positive is enrolled to a certain facility or in a certain program, whereby this program, basically they usually go each and every visit. It might be monthly, it might be after 2 weeks, it might be after 3 months, it might be after 6 months, depending on how somebody has been adhering to drugs. Anytime this person actually visits a facility or their clinic, that is when they are going to assess how this person has been able to adhere to drugs. When we check your weight,
Yes.
we'll be able to know if you've been faithfully
Taking your drugs.
Yes. If maybe the last time you are 40, you come back to the clinic, we test we weigh you, we get that you are 50. It means kudos, you are doing so well. You've actually been adhering to each and everything that you've been told before. But you come to the clinic after that month, we do the weight for you, we get you are 30 and you are 40. Basically, it needs a lot of counseling and also just assessment on what is making the drugs not work.
What about this patient who is supposed to see you as the healthcare provider every 2 weeks, but disappears for 2 months? How do you follow up that patient?
Actually, what usually happens, the ones, basically I've just touched on 2 weeks, depending if somebody is being like initiated, enrolled. You get maybe their period is a bit, the difference is being put a bit smaller, so that they can just be able to know how they are doing. And the person who has been given like 6 months and 3 months, it means that huyo ni mwenyewe.
Working well.
Huyo ni working well. Na ni mtu, somebody who has been taking it for so long and they don't have an issue of taking drugs. They don't forget. They try to do each and everything that they've been told. That is on positive living. And treatment works well. That is when I am adhering to my drugs. You've talked about that. But what other ways do myself as a person living with HIV ensure that apart from me adhering to my drugs, the treatment works perfectly? We usually have the CD4 count when somebody comes at the clinic, that it's usually done. We usually say a normal CD4 count is supposed to be from 500 and above. Coming below 200, that's it calls for an alarm, and it needs a lot of attention, especially to the person themselves, especially with adherence to drugs and just eating a balanced diet, exercise, taking water. We say enough sleep and rest. It's very important. You don't just sleep for 1 hour. You have to have enough sleep and rest. Then also stress. This person also needs ongoing counseling just to support them. But CD4 count is there. Also viral load is there, just to see the amount of virus in their system.
So it's like a whole process. It's not just one thing. It's bits and bits and bits that are adding up to the whole success. And that is why we have you people. Thank God for you people.
Thank God.
Counsel people living with HIV and AIDS. And I just want to know, now that I am taking my drugs and I am adhering to all of these things, and I am getting worse, what's next for me? I'm getting worse. Getting worse, getting worse, getting worse. And I'm doing all these things, by the way.
Is it realistic? I don't think it's realistic. But if you're taking drugs and it doesn't help you, this person, whenever they come to a facility, the clinician is there, then they may be able to check now on the HIV drugs regime that they had given them. They might just be able to change for them according to their situation at that time. That's why you get there's first line drugs and we have the second line drugs, depending on how their immune system is.
Wait, so what is the first line drugs?
They're just part of ARVs, but I won't want so much to tackle on them, because we want the viewers just to know that in case it happens, you just go back to your facility and you get the best support.
And now that you mentioned the first line drugs and the second line drugs, there's this thing called resistance, drug resistance. Sometimes you find that I'm so used to taking Panadol, I just feel a small headache and I'm taking Panadol. So that I'm used to this habit. The next time I'm taking it, it doesn't work as well. What do you do for such a patient?
Because like if I go back to what I've told you, there's the first line drugs and the second line drugs. That's actually what usually happens with a HIV positive person. We don't want to say that the first line drugs are not effective, but if we reach a time that they become resistant, they doesn't help, they don't boost the immune system, they don't stop the replication of the HIV virus itself in the system, then we can be able to initiate now the second line drugs, which are also part of the ARV, and they are going to support this person.
But there's no one point the two can be done at the same time?
The first and the second line drugs?
Yes.
No.
Okay, so HIV positive, and where do I find the healthcare professionals to give me the care that I need?
You can be able to get them to in all government facilities, even private facilities, because even us is a faith-based organization involved with the church. You can be able just to walk in anywhere and be able to get all the support that you need.
So just any healthcare? Any
healthcare, but I will really advise somebody to go to a government facility.
Okay. Apart from the antiretroviral therapy, what other therapies, complementary therapies that boost the drugs? For instance, let's say medication or something.
Maybe also we say health reform.
Health reform.
Eating healthy.
Okay.
Can be able also to boost and support somebody when they are taking the art itself. We also have the exercise. We have different kind of exercise. We have swimming. We have others just like jogging. So
it doesn't mean you go to the gym and start lifting weights. I think we'll talk about that in depth.
Yes, and it's very important for somebody before they start doing all this just to go back to the clinician or the doctor and just ask them on, especially with the exercise, because you can go try something, then uzimie, then whom are we to blame? And you've said exercise, so it's just
Brenda said exercise, or my nurse said I should exercise, and I go to the gym and I faint there. What next?
Anyway, the whole point is just not to be lazy. You know, sometimes you beat yourself up saying that, you know, I've been tested, now I'm HIV positive, everything is just, I'm done, I'm finished. Yet you're not finished, you're still breathing. You still have so much God has put for you. Just need to focus, know that it's part now of you, is now on how to live with it. And HIV is very manageable, so long as you just adhere to each and everything that you are told, and you live well and a long and healthy life.
So what advice would you give to someone who just got diagnosed today, and that person has been diagnosed with HIV positive? What would you tell that person?
I would encourage them to accept. That's the first step. Just acceptance. Don't go from one facility to another.
Trying to confirm
and giving out your finger. Surely you'll prick your fingers and double prick and double prick. Just accept you're HIV positive. Then just sit down and reflect on it, and also see whom you're going to confide to. Looking for a confidant is very important. Maybe the person you are thinking that you're going to confide to, they'll even mess you up. They'll even really mess you up. So it's also very important to get somebody who can be able to confide to, because this person needs love, care. And all this support from not just us as healthcare providers, even whenever they are staying, their surrounding, it's very important. Then also this person just need to look on the positive living itself. That is exercise, taking enough rest or sleep, taking clean water, eating a balanced diet, and most of all, prevention to avoid getting reinfection.
To avoid getting reinfection, to avoid infecting others.
And also, infecting themselves.
How else do we curb the disease? It's incurable, but we have to manage it, we have to live with it.
Very true.
Well, Brenda, this is always a pleasure to be with you and to talk to our viewers and to let you know that all hope is not lost when you're diagnosed with HIV. It's been there for decades, but look at us, we're still living. Have you ever heard of a case that has been cured? Have you ever heard of one?
There are rumors, but as a healthcare provider, I won't want to say that somebody has been healed, because I usually say when you look at faith and man-made, they will never work together. They will never work together, but they just work together if you balance both of them. If you believe you are healed, you are healed. But what really surprises me, somebody comes and say they are healed, they've been prayed for, and they want again to have a retest. Why come for a retest?
Believe it. Just have faith that you've been healed.
Yes, how can you come and have a retest? We do for you the retest, you still get your HIV positive. Look at the preachers who are there. What are they doing to these patients? It's very sad. Very, very sad. So I just encourage somebody who's HIV positive, just try to accept. If you can accept, we have different people on how they take feedback. Others accept immediately. Others ask whenever we get in situations in life, we take time. But it's very important, any person who's been tested positive, accept as early as possible, then start the ARV therapy immediately.
What about, those people who go to witch doctors and believe that there are herbs out there to cure this virus? What would you tell them?
Actually, there have been cases going on around even in media, whereby you get people have gone even to Lolianda.
People use so much money and travel so far to get these herbs. So I'll just encourage all these people who decide to go to these people to get support, the witch doctors and the herbalists. The medical drugs can never be mixed with the herbal drugs. It never works like that. If you decide you are doing herbal, do herbal and stay there. If you decide you are on ARV therapy, please stick there, adhere, and you live a long and healthy life. Wow. I just, you just hit the nail on the head every time. And viewers, I will continue singing this song. Brenda, we will sing this song. We will sing it, and it will. If we have to drive it into our viewers' heads, we will. HIV and AIDS is incurable, but it's treatable. And thank God for advances in technology and for things like PrEP and PEP, the milestones, and the many more groundbreaking milestones to be made. And with time, we will be able to not only manage, but hopefully find a cure.
Very true.
Is that not what we all want?
Very true, very true.
Because if we found a cure for TB, everything is possible. With God, everything is possible. He wants the best, the very best for us. So dear viewer, thank you so much for being with me. I am Kandi Odhiambo. We've been looking at treatment on positive living. And the next time we join me, we'll be looking at nutrition. You on your antiretroviral therapy. But it's not just that. You need so many complementary therapies, let me say therapies, to get your life as long as it takes. Not just as long as it takes. I will also sing this song, a healthy and productive life. Please, please, please remember to interact with us on our social media pages. That is on Facebook, Hope Channel Kenya, on Twitter at Hope_Kenya. SMS us. Let us know your views. Thank you so much for joining me. Until next time, goodbye.